Yes. Okay, cool. All right, let's do this. We've got it.
Thank you so much for tuning in here today. I am honored and so happy to have with me the award-winning, infamous Dr. Amber Enright, who is
Hello.
a neuro-oncology therapist. She goes out to the homes and works with the patients. And the thing that I'm just so, one of the reasons I'm so thrilled to have her here is because her number one outstanding attribute that I believe works is love. And thank you, Dr. Amber, for obliging me in this interview. And I do trust that it will reach many, despite the technical difficulties that we had this morning. Thank you, and it's an honor. Please, first of all, just if you could tell us a little bit about how you came to be this amazing doctor therapy of oncology.
So it's a little bit bigger than I think that I had originally intended. I, like many others, wasn't really sure what I was going to do, even in physical therapy. And even when I had decided on this profession, I didn't really know how many fields it really holds inside of it. A lot of people don't know that we do women's health therapy. There are specialized women's health physical therapists that work on pelvic floor control and incontinence. There are oncology specialized therapists. There are pediatric specialized therapists. I happen to be one of the Arizona's very first head and neck cancer physical therapists certified by PORI, which is an oncology rehabilitation institute, and they are based out of Denver. Fantastic organization and educational courses through them. But I really started in pediatrics. When I very first decided I was going to be a physical therapist, I already knew that I had a special connection with children, and that I could get them to do anything that they needed help doing. I really, it didn't matter if it was learning to climb up something, I was able to, or math or reading. I was able to connect with them. I loved it. And that came from a lot of my own personal and family history where we did foster care growing up. And I mean, one time in our house, we had 9 kids, and my saintly parents were probably pulling their own hair out. But it was always the job of the older children to help the younger children, to look out for them, to protect them at school. Like our own little family, we just had each other's back, and it was a big hug to be part of it.
Says that was an indoctrination of love, which is awesome.
Yes.
It
actually gives me goosebumps when you say it that way. Yeah, I really appreciate that description of it. It really is. It's nice to be a part of something that is bigger than just you. It's a nice mental and emotional checkpoint that if you fail, someone will help and scoop you up and help you succeed. Yes. And so after I had done pediatrics for a while, when I had entered the workforce, I did love it. But the other area in the actual clinic that I first worked in, which was in my hometown of Sierra Vista, Arizona, it's a small town. And we saw people from Tucson through Douglas, like everything in Southern Arizona. There were not a lot of pediatric resources at the time. This is 10 years ago. And so everybody had to go for specialty appointments to Tucson and Phoenix. And it was, a 6-month waiting period. So, and I was a new graduate. I still felt very overwhelmed by the patients that I was seeing. And I was always worried that they needed more than just what I could offer them at my new experience level. So my job was to learn as much as I could, as quickly as I could. And the other caveat to the clinic that I worked at is most of the therapists were all orthopedists, meaning they saw knees, hips, shoulders all day long. And that's primarily what, it's kind of a retirement community and a military community. That's what you'll see in those communities is a lot of joint replacement surgeries. Well, the other population that was not served in my community was the neurology. So it went all through people with autisms, adults with CP, people with spinal cord injuries. Almost any wheelchair user was considered a neurologic patient, whether it was truly orthopedic, meaning it was a joint pain that was restricting them, or a true neurologic condition,
Yeah.
cancer, children with cancer. So I saw everything that no one else was really qualified to treat. And as a new grad, that's saying something. I was just more interested in learning about new things. I think I didn't feel more qualified, but my interest and my fire and my understanding that I didn't know it all helped me serve these populations better. I also decided at that time in my career that I was going to be an advocate for a lot of different kinds of patients. No matter who walked through my door, if I felt that they were underserved, it was my job to help them find the resources that they needed. And now that I've primarily switched to neurology and oncology, I think that that serves me better than anything else. Is I want to make sure that this person in front of me, even if they're not going to be my patient, has the resources that they need.
What a beautiful contribution to humanity. I
Oh,
believe that is because, you just have a heart for those who don't have a voice and who need, who have needs that are being unmet. And through that journey of seeking to serve them as best you could, you arrived here where you are in a place of great need. It sounds like your path was going where the greatest need was,
yes.
that your heart just felt drawn to support. And wow.
I actually feel really lucky because of my very first job experience. If it hadn't been that way, I wonder if I too would have kind of gotten, I don't want to say stuck in a rut, because some people really are passionate about doing like orthopedics every single day. And I do like seeing orthopedic cases, but I also really love the problem solving of meeting someone. Now, like I can meet two people with the exact same diagnosis. You can have a temporal stroke of this degree, and they are not the same, not in any way, shape, or form.
Yeah.
Or even just that word. A lot of people think that, oh, I had a stroke too. I mean, I've had stroke patients that their primary functional limitation is literally laughing at everything. It's like the funniest impairment ever, but could you go to work and be walking and think that's funny down the hall and you're literally laughing out loud, and
Wow.
your coworkers are like, okay, can you stop? I'm on a business call. And so there are so many things that can come into each diagnosis being extremely unique. And as a provider of any kind, we all have to recognize that component. It's not that they're so special. The things that we treat with have to fit that person's needs, but their impairments are their impairments.
It's what comes to my mind is the appreciation that you have for those distinctions. You're not trying to lump them or categorize them. You're actually appreciating their uniqueness and their differences and serving them to that part, to that, to that need
Yeah.
and that uniqueness, which is that's why I believe you're award winning. I believe that's why people are drawn to you and you're being recognized. And what I would love to see is more of you, more people like, more practitioners like you. And that's one of my reasons for having you here, because I'm sure when people listen to this, they will be inspired. Others who are going on that path or seeking that path or just trying to figure out what their path is. So many people want to serve, but they don't have any idea of what the possibilities are. And I think that
Yeah.
your example is perfect, is wonderful to just inspire people to begin where they are. And
As you're speaking, it's just so interesting, because like you make me feel good about what I do, and I've never really sat down and put them in words like this, that I guess allow people to look at that whole picture or get to know me as a provider. And I think that some of that is I've always wanted to make sure that it was about my patients and what they're going through. And so this is like a really, really nice new experience to even be able to get feedback on how I like to present and how I think of myself and my business and what I represent and what I want to portray through my opportunity as an entrepreneur, because there's so much to that. I, like everyone, didn't really know what I wanted to do. And I feel so grateful. You know, I graduated with my doctorate degree when I was 25 years old, and I went straight through. I just thought, thank you. I just thought, well, when I was young, I didn't think I was going to graduate high school. And then my parents, they said, no, of course you're going to graduate high school. You're going to go to college. You're going to get a degree. You're going to have some kind of job. And I know that's not for everyone, and that's totally okay. But my parents just looked at me and said, no, we understand what your potential is. It might not be the same as your brothers and sisters. It might not be, but if you don't pursue this, you could be failing yourself. Wow.
I just have a question for you. Why did you think you weren't even going to graduate high school?
When I'm adopted, and I was adopted when I was 10 years old. And so, I was placed in the system right before my 8th birthday, and nobody had ever asked me until I was 10, what do you want to be when you grow up? No one had said, nobody cared about my schoolwork. No one cared if I had a lunch, or nobody cared about those things. It was just a new concept. You know, the things that I learned were like how to blow my nose into my t-shirt so that it didn't show on the outside. You know, I know how to like spit 10 feet. I like knew how to wash my hands with spit and wipe them on my pants. These are things that as an adult I had to unlearn, or even as a young teenager I had to unlearn. And I thought those were all the coolest things, but I didn't learn about my potential. I didn't learn how to study well. Now I got great positive reinforcement from my teachers at school. And so what that did allow me is the opportunity to have interest in learning, interest in school. And so, you know, for the many teachers that I had when I was young, they'll never know how important they were to who I became, just as much as my parents who adopted me. I have a huge, crazy family. And if it were not for each of them, I would never be sitting in the seat that I'm sitting in. I mean, every single one of them is so different. There's 18 years between my oldest sister and my youngest brother. There's 25 years between my oldest sister and my youngest brother. So my parents had 3 kids. They kept adopting. They're 25 years my parents were parents, and they still are. And it's mind blowing to think they invested so much in each of us that we could each turn into whatever we wanted to turn into. And that's really the opportunity for every single person. I always say everybody could be a PT. Everybody. What kind of PT you're going to be is up to you, just like in any field. There's good and bad of every single thing you come across. And so it really is, it's how we want to live and portray ourselves. And if the environment that I'm in is not serving that purpose, I'm going to find a new avenue for it. And that's my job.
Would you agree that whatever you're doing, whatever your calling is to do in this life, that all of your experiences contribute to that, to make you a unique, whatever you are, physical therapist, doctor, lawyer, teacher, engineer, whatever it is, all of your unique experiences are part of who you become in your, it's usually in your heart. Whatever it is that you're going to be doing, it's something that you're driven by your passion and your interest and what excites you, right?
100%. My little sister says we always have this competition about who's the whatist, right? So who's the smartest, who's the whateverist. And it's like a nice sibling rivalry where we're always like slightly competing with each other at something, but one of us is the best at something. My youngest brother is the most athletic. And so my younger sister would say, I'm the smartest. I would say my older brother, Kevin, is the smartest. When we're thinking about these things that we want to be the most of, I actually think of myself as the most emotional. I'm the most emotional of all of us. And when I was young, it wasn't a serving purpose, but now that I have this other calling in my life so I don't just treat people, that have cancer. I treat them from diagnosis through end of life. So
Wow.
I treat them through palliative and hospice care. I try to help make sure that they're also know how to use their benefits appropriately. So if they need some extra service, that because I'm a cash pay therapist, I need to be very mindful about people's resources. It doesn't matter how much or how little you make. I am a absolutely not tangentially required resource. I'm a necessity in that home. And I also take it to be
Absolutely.
my
I
responsibility
just,
that I utilize that appropriately. So my emotional capacity very much serves because I try my best to come into every, like I did in this interview, with a smile and positive energy that people can feel that you're giving out freely. And it doesn't always come naturally, but it literally came because I knew these patients needed it. And
that
I
does
was there
come
to serve
naturally,
that.
because when you feel that need, it flows from you, you know, and that is such a beautiful thing. And for anyone listening who is also having that struggle about feeling too emotional, please hear it has a place, it's appropriate, and it's balanced or tempered by getting the job done, getting the work that needs to be done to help your people that you're helping. I so
Absolutely.
appreciate what you do and how you do it, Dr. Amber. And I mean, the what we see in other people, like you see the smartness in your brother, or you see your brother being smart, and he sees, what we see in other people is a reflection of what's in us
Yes.
that's not fully acknowledged, or not completely acknowledged or appreciated. And the more we appreciate it in us, the more we can appreciate it in others. And this goes for the things that we see in other people that we don't like, that we're, that gets under my skin. Well, it's because it is under our skin.
Mhm.
So
Yes.
when we make peace with it, then we'll have peace with it in that other person.
Mhm.
But I want to get back to you, because you have done some exciting things. Can you share with us one of a few of your stories, but the one I'm going to ask you is one that you were surprised at the way things went, as opposed to what you saw when you first met the person, let's say.
I would say that happens all the time. Maybe not surprised, but when I walk into a home, because I'm coming into your environment, it's a little bit different. There can be different plays on how that will pan out for me and what I need to get my point across. Um, so one that I was like most surprised about, we had a patient come in about a year ago, and he'd been seen by doctors across the country for about a year and a half.
Wow.
And he had what they called a complete spinal lesion from cancer in his spine. And the lesion was cancerous and it was metastasizing. And he had been told that he was not able to move his legs, that he needed
Wow.
to get used to a wheelchair, that he needed cancer treatment. And he was at a cancer facility that's incredibly expensive. I mean, he had put up everything he owned basically to get treatment at this facility. And so he'd seen multiple very, very astute, very well-known facilities. And I specifically tested him. Now, in neurologic testing, you actually have to go to each muscle and each sensory input and test it one by one. And every area of your body has a different motor function and sensory input. So like how I can feel it and how I can move it. Those are different pathways. You have to test both. There are ones for the bottom of your foot versus your butt cheek versus the side of your trunk. There are actual anatomic deviations for each of those. So when they go through these tests, it's supposed to be very specific, and somebody should be testing each of those areas.
Especially like, that's why it's supposedly why it's so expensive.
Yes. I mean, when you're going to neurologic testing, and actually physical therapists help with a lot of like Special Olympics testing to make sure you're categorized in the right area, that kind of stuff. So it really is, there's a massive science. It's very well known. It's very black and white. So I asked him about the testing, and I asked him specifically if anyone had done this kind of testing with him before. And he said no. And
Wow.
I was shocked. This man had been sitting in a wheelchair for a year. His legs were the size of balloons, because when you sit and think of if you've been on a plane, or for pregnant women, your lymphatic system and your circulatory system, they're retaining a lot of fluid outside of your circulatory system. So you get lymphedema basically when your feet swell up, anything like that. That's like a low grade lymphedema if it's not going away by the morning. And most of us don't have to worry about it because we're active and we move, and our muscles and the tone of our muscles help us actually pump all that extra fluid out and recycle it appropriately. Lymph is like the waste management system of the body. So it's just trying to get rid of stuff and recycle and recirculate it appropriately. This man had, 20 pounds of lymphatic fluid on his body. So I did these simple tests, and I said, well, you actually do have activity in your legs. Let me tell you what we can do. And so in that very first appointment, and I wasn't even the first therapist to see him. This just sometimes blows my mind, because you can go to a therapist, you can go to a doctor, but if it's not their area of interest and specialization, then you probably need to find another one if it's possible. Like in Sierra Vista, I was the only pediatric therapist and I was a new grad. I was going to do my best by those patients, but not always am I the best resource. If I needed to have them seen by some behavioral specialist or some other kind of specialist, they had to go to Phoenix for that, but I was happy to say that. So this guy was definitely in my hands, and I was happy that he was finally. I didn't get to see him over the course, because eventually he did end up going back home, and he does not live in my state. And I helped transition him to another therapist. And I interviewed 3 therapists within a 50-mile radius, because there wasn't a lot where he lived either. He sent me this year for my birthday a video of him walking with a walker. And this guy has mets. He's got mets all over his body. And it hurt when he first started weight shifting, and learning how to pivot using his arms. He was in a lot of pain, but he trusted the process, not based out of hope, but based out of the work that I was able to give him to do himself. That is true empowerment. That's the obligation that I need to give them.
Wow.
That's the reality of it, not just selling hope. Oh, great. I think you could walk again. That just sounds ridiculous. When you tell someone you have muscle activity, and if we train it correctly, we could easily be having you pivot by this date, maybe taking steps. I could help you stand. We'll see how that goes, how it feels, how your bones are holding up. So there's a whole process to it, and you need to be able to give people realistic expectations. And sometimes I have to do that in the first visit, but that would be one outcome where I was like completely shocked, because all the paperwork told me one thing, but I'm not there to treat the paperwork. I'm here to treat the person in front of me.
Just go on without doing any testing? How many?
This is the era of telehealth also. If I had been treating him with telehealth, I would not have been able to feel the muscle activation. So the first forms of muscle activation are more like twitches under the skin. You might not even be able to see them. You might not be able to see active motion. And so if I hadn't been able to feel what I could feel, not even just the motion, but facilitate some kind of activity under there, it doesn't mean I'm making miracles happen. That is the work of the body if I give it the right input. So
Yes, yes. And
yes,
just
maybe you
knowing
could, yes,
people, like yourself, skilled to know that, have the knowledge to do all of the testing, because this is an amazing healing machine when we
yes.
understand it in that context.
I love
And I
that you
think
put it that
that is
way.
another huge key that you have, that that I would just love to more doctors to know about.
Yeah. That's so interesting because I know you do a lot with like stress management. These people are frequently coming into me with like the highest amount of stress in their lives, the most difficult processes emotionally, and disease can happen in so many ways. Disease can impact our psyche so much,
Absolutely.
our spirits, our souls. Some people will go home and crawl in a bed and be like really upset at the world and how the world is treating them is what I would gather from that. And we can all put ourselves in that moment where we have almost gone to like, no one understands this. I'm going through this thing. You can't possibly be here with me. And then, no, I do not have your kind of cancer, but I can be here with you. I can be here with the ups. I can be here with the downs. And let me tell you what you can control. You can control how you perceive this moment. You can control how someone walks into the room and interacts with you. You can control how they feel around you. We have so much control over really bad situations. Bad things
Absolutely.
happen to everyone the world over on every level. Yeah, here we go. So yeah, I love your wall, being aware of how we are presenting ourselves, literally noticing how my energy is impacting you, because it's not just about me when I'm in a room with you. It is also about you, whether I'm going through something or not. But these are more of the skill sets that, again, probably set me apart a little bit in my field, even because I think that all PTs are very nice people. I love hearing people, oh, my PT's the nicest, they're the best. They probably are, because I think that PTs just are that way. They want to give their time, they want to help people.
They want to
Um,
help people, right?
but it is not the same as private therapy. It is just not. It can't possibly be. When you see some therapists are seeing 25, 30 patients a day. I see you for the whole hour. I'll see you for 90 minutes if you need that kind of care. I see some people 4 days a week. More than any other provider, I spend quality time with these patients outside of caregivers and spouses.
Wow.
So I'm the first to notice a lot of stuff, and I want to get them the right people, the right help. For people who can and cannot communicate verbally, it's a really, really, it's a bar setting quality that you have to have if you're going to go into people's homes and treat them like this.
Yes, I would just love to see more therapists doing what you're doing and the way you're doing, of course, with their own flavor, but the actual service of the knowledge, the approach, and incorporating, you're incorporating mind, body, and spirit, because you're letting them know the mindset, you know, this is a huge part of it. What
Mhm.
you think, what you expect, that's a big, that plays a role in the healing process, and
Yes.
how you feel about, what you're going through. And so you present a whole package that is really unique in it, and I would love to see it multiplied. Not
I
you.
would too. I mentor some other
Excellent.
physical therapists. Right now I have two. One does adult geriatrics, and he
Mm.
advertises himself as training older people like they're athletes. And then another one is a pediatric therapist. And I want to give these providers who I think are really great providers, not just like nice people, but great providers. I want to give them the opportunity to learn how to do more with their position, how to do more with their business, and not as like necessarily an all altruistic experience, but I want to see other people succeed like this And I want to teach them how to do that, because in any profession that you're going to have an impact in with other people, you need these qualities, you need these skill sets. You need to know when to correct them and not let them wallow and sit in a corner and feel apathetic, like complete loss of emotion and I don't care. We can't live our lives like that. You will prematurely age your soul, your body, your mind, your emotional capacity. You might feel like, oh great, I don't have to make choices. That is no way to live any life, no matter what stage you are in.
Yeah, it just spirals one down when we're here to spiral up. We're here to spiral up.
I love
And
that.
that happens when we look for the good. We look for the positive. We focus on the good and the positive. If we focus on what's not right, we will spiral down. I want to include information on how to reach you for mentoring, for therapy. And so I'll include that in the post. But if you want to give it out now for someone who is
my website is aztherapydoc.com, aztherapydoc.com.
Okay.
And my business name is The Therapy Doctor, although I'm actually probably rebranding my name soon. So my website will still say the same. And then, of course, you can call our company at 480-797-1403 for a consult. We also do in-home massage, even medically necessary massage, and lymphedema massage, which is you have to have a specialized certification for that. I am not a massage therapist, so I do not do massage. I stick to my lane, which is physical therapy and wellness.
Yes.
And again, I'm a cash pay therapist, so I do not accept insurance, but I do like to help walk people through that process of what it looks like and or consult on their case. At the very least, very often, I'm just a phone call away for some people who are not receiving care by me, but they need more information on how do I even get to the process of getting home health through my insurance. I'm happy to answer those questions. And I love doing it. So
I'm so honored. And I mean, I love what you do.
thank you.
And I would love to see it more accessible to people. And so in this video share and just peering into more of what you do, can you share another story that you would love for people to hear, to be able to, just like I said, for inspiration, for maybe even someone who might happen to be listening who is in an insurance company in a place of position to be able to change things for what they would cover?
Yeah. Okay. So I worked all over the country. I worked in DC. I worked in like the Appalachians and Virginia. I've worked so many places. And I think that something that happens with care is a lot of people think that cash pay is inaccessible to them, or that it's like kind of it's like a wealthy person's accessibility point. One of my patients about a year ago came from an old classmate of mine. She lives in Hawaii, and it was basically for someone it's basically an uncle to her, someone she grew up with. And she knows that I treat stuff that no one else in my class graduated with this skill set. I didn't graduate with the skill set either. I honed it. And so when she comes into the States from Hawaii, I would ask her like, hey, do you want to come over? You can help me. We can do a co-treat. Like, I'd love to get an extra pair of hands. We can get into some new activities. And so there's this like exchange of knowledge and respect. But she called me for this person who, and when I'm thinking about this, it kind of makes me upset. So he had been hospitalized for a really long time, pulmonary fibrosis, which basically means that you can't breathe. And there's a whole bunch of backup in your lungs and resistance to breathing that makes every single activity feel labor intensive, like you're gasping for air just sitting up at the edge of the bed. When you have spent months in the hospital and you're laying in a bed your body literally becomes more rigid. So, people think, oh, I'm in the hospital, I can't get out of this bed. I hear that all the time. I used to work in the ICUs. No, I can't get up. I've got all these lines and tubes on me. Yes, we have to get you up. And this is why. One is for appropriate discharge planning. Did you know that there's a therapist typically that walks into the hospital room and says, okay, we need to get you up out of bed and help you get over to the toilet. We're going to go for a little walk. Let's see what you can do. And they do some basic assessments. That test is an evaluation of physical therapy, but the one part that they don't really always mention is that's to make your discharge plan. Your discharge plan, meaning, or do you need to go to a skilled nursing facility? Well, nobody really wants to go there. Do you need to go to acute rehab? That's a great option where people can get 15 hours a week, and it's a requirement to be in this facility. They usually get you from really, really, really impaired. Like if I had a major stroke and couldn't move half of my body, over to your home setting is the actual goal from there. So you're there for a much shorter period of time. The therapy is the intensive focus. And then typically home with home health or 24-hour supervision. So if you can just get up and move, you're home independently, discharge plan is done. So the key is to make sure that you're able to complete the environment that you're in. When you get ill, you may not be able to do those things. So it's important to manage how active you can be, your cardiovascular fitness, for these other things that can happen in the future, not just for now. So this gentleman that I had, he was able to be discharged home because he had 24-hour family care. They really could not afford my service, is what I would say. They told me that. We came up with a plan for it. We came up with a plan where they could definitely understood how to use their benefits as well. And then I filled in the gaps for the many, many, many times where their insurance for home health would just drop out, meaning for 3 to 7 weeks, they would have periods where they didn't even hear from the home health company.
Wow.
Not as a slight to any company. I know that we've been dealing with COVID and we've been, isolated and staffing is difficult. I've never had that complaint in my company. I've never missed days that I say I'm going to be there unless I had some major thing going on. I don't think that as a company, you can take on patients if you cannot serve them.
Right.
If I have a waiting list, I have a waiting list, but I can't take you on and then say I cannot serve you as my patient. I find it to be somewhat unethical. So this happened to this family, and I was happy to help them navigate, to call an advocate, to be there in the interim when their insurance company was completely failing them. And it's not just insurance, but insurance is almost designed to do that, where, okay, great. I had another patient that I've never, ever actually treated, a wife of we'll call it a consultation, and referred over to me. Now, the way they described it when we first started talking was she knew a lot, so much about the diagnosis that her husband had been given. And 3 or 4 months before, she'd been seen by a really fantastic neurologist. They had some information, but in speaking with her, and I did not need to say this, I could tell that she knew some of the common lingo, but did not know a lot about this disease process. And that is okay, because you didn't get any information when you left your doctor's office. You did not get any information from the home health company. And so she had a script for home health that was 3.5 months old, 4 months old. She'd never had a home health person show up to her house. And I said, you need therapy now. If they thought you needed it 4 months ago with this diagnosis, you definitely need it now. If you want to pursue the insurance-based model, you need a new script. That script, if you had tried to turn it in over 30 to 90 days after that, it's no good anymore. So you could be sending it to 12 companies, which usually they actually set that up for you. Said, so you need to go first and just call over there. I don't think you're going to need a separate appointment unless something has dramatically changed. Just call your doctor's office, tell them you never got that service. They can write you a new script. And a week later, she had someone show up to her house. I needed to just walk her through that process so that she could be an advocate for her husband. Those are the things that can change how functional you are. That woman has called me 3 other times. I have no doubt that she's going to be my patient in the future, or her husband is going to be my patient in the future. But those are things that impact people's lives way outside of what I do as my personal, income driven job. But just as a person who wants to advocate for people who cannot or don't know how to use their benefits. And I think that's horrible. If you don't know your insurance person, the person that literally bills your insurance, get to know them. Ask them how to use your benefits. How do I use this now that this is coming up? Okay, this is coming up in the future. How do I use it? Now, I'm not an insurance specialist, but I do know those pieces.
You know, the sad thing that came to my mind was that people need an advocate when dealing with the medical industry and the insurance industry.
Mhm.
And that's a sad commentary on our medical and insurance industries. That needs to be reformed, because people shouldn't have to have an advocate outside of the company in order to get what they need, to get their needs met within the company.
Yes.
But you know, that's where we are now. And thank goodness for you, who is one person helping, you know, tens of people. We need thousands of you, or we need the system to change. Because
Agreed.
so many people, you just a teeny tiny sampling of the true reality for most.
Yes.
And yeah, so an agent for change this is.
Thank you. Yes. And I do hope that other people literally enter this space with that same interest of helping people navigate what they already have access to, and then absolutely helping fill this giant void that is in the system. I mean, we have to do better. We must. It shouldn't even be an option. Anybody that looks at it can see that it is completely inadequate to treat people like this. You can't tell someone you have Lewy body dementia and then let them leave the office without a follow-up appointment so someone can talk to them about what that means. What does it mean? What does it mean? If I have brain cancer and they say, oh, I'm going to do this surgery, and then your brain cancer is gone, do you know how many people think that that means that they're just going to be able to live because their surgery removed the cancer?
And they think they're going to
preparing
like they did before pre-cancer.
Right. And so my job is also to sell reality of these are the devices that I think that you're going to need in your home. I had a ceiling track installed in a woman's home because she's going to need massive care. And sometimes she doesn't. I actually am able to freely have her walk down the hallway right now, which I went to a neurology appointment with her the other day, and this is absolutely unheard of with her diagnosis. There's no patients that would make this much progress in 6 months outside of her, like none. And I've been treating this lady for 4 years. We had a huge lapse during COVID because her physicians literally said it's too unsafe for you to have a physical therapist come into your home. The exposure risk is too high. Well, you know what I would say is the quality of life for her was too high to risk her now needing 3 people when I got back to pull her out of a wheelchair. What does that mean if you need 3 people? It means that if you don't have those people in the home, you may be sitting in something that you don't want to sit in for hours on end, risking way more than just mobility. So, you know, I think that our understanding of each other's professions has to really increase. What do I refer you appropriately for? Where do I get that resource? And if nothing else, I hope that this podcast really, or this live really helps other people understand a little bit about like what we can do and how to find an appropriate therapist, not just a therapist, but an appropriate therapist for their patient.
I just want to encourage those of you who are watching this or listening to reach out to Dr. Amber with the questions that will help you to serve your patients better.
Yes.
With or resources that would help you to get the knowledge needed to better serve your patients. And if there's anyone involved with the insurance, or if you're an advocate, whatever your capacity to serve this population, you know, put your questions in. And that was what I was really hoping for this to be able to, they would be able to come with their questions, but it is what it is, and it happened the way it was supposed to. I appreciate your way. This is one of the reasons that I have you on here. This is the mental and emotional health holistic approach. And your approach is absolutely holistic. And when we I believe that the holistic approach comes from the element of love that you put into your work, that it just exudes from you. And that is what enables you to care about all of the aspects of this patient.
Yeah.
All of the aspects. That's what we need more of. And if you don't get anything else out of this cast, know that when you infuse love over everything, it really does conquer all.
I agree
All
with
the
that.
obstacles, all the challenges. It cuts through them. And I believe that Dr. Amber Enright is a perfect example of that.
Thank you. Thank you so much. I really have enjoyed this. I actually can't wait to do another one of these. So hopefully you have me on in the future. I thought that it went really well. And thank you also for just being so open to really the stuff that's outside of exactly what you do, but helping us all to tie it together, because it really is, it's a missing piece in healthcare.
Yeah, definitely a missing piece of healthcare. You hear that? It's a missing piece of healthcare. And so we want to put in that missing piece. I love doing puzzles. This is the piece that we've got to put in there that really, and there's lots of pieces. There's your piece and this person's piece. There's all these pieces, but the thing that makes it whole is the element of love. And that is caring, and caring enough to treat the whole person.
Absolutely. Absolutely. Well, thank you so much.
Thank you, Dr. Amber, for being here, for sharing your exquisite knowledge. I mean, it's, like you said, you wanted to know all that you could to help your patients. And I think that is so key. If we would all do that to the best of our ability. Are we going to do it perfectly in somebody's mind? No, but it's perfect because of what you put into it, and which is primarily your heart.
Thank you so much. I appreciate it.
I'm going to please, if you didn't get the phone number, I'm going to give it one more time, but it'll also be in the description, in the comments. So look there if you didn't get it. Okay.
Yes,
Go ahead and
absolutely.
give that contact, the website, the phone number one last time.
Yes, the therapy doctor at aztherapydoc.com. And my phone number is 480-797-1403. Happy to consult or book.
Perfect. Thank you so much.
Thank you.
We'll be back sometime. Look to hear from you.
Bye.